All right, well, welcome back, everybody. As most of you know, we do a little review of just recent studies, literature, etc., and common questions that I get, I try to answer, and then we'll go through more of some of the basics. So today I was going to do I'm following a low-carb diet but not losing weight, going through some of those. I know not everybody here is trying to lose weight and doing it for other reasons. So we'll kind of move through relatively quickly and then get to questions and answers. But I always get questions about cholesterol and low-carb diets because you do tend to increase the amount of saturated fat you eat. I will say that there's varying data that some patients who follow a low-carb diet, the majority will lower triglycerides significantly, raise HDL, and some will raise LDL or total cholesterol. Others will lower it. Others will stay the same. But this was a presentation by Zoe Harcombe, and if you're not familiar with Zoe Harcombe, she's a great person to follow. She's a nutrition researcher. She does a lot of presentations, especially when it comes to government and higher ups kind of. So she's very big in the world of cholesterol. She wrote a thesis paper, I believe, on that as well. But this was a couple of slides that I pulled out of her talk that she did. And this is total cholesterol, not in American units. So this is in millimolar per liters, but you can see just basically a scatter plot. This is in males, deaths per 100,000, cardiovascular deaths, and cholesterol. And you see that those cholesterol dots are kind of all over the place. So higher deaths, even at lower numbers or at higher numbers, are kind of, again, really scattered. But the line is slightly to the negative, showing that maybe there actually might be an improvement or less deaths when we get to higher levels, although, again, scattered throughout. When we look at females, it's even a little more, again, very scattered, but that line is steeper. And then when we look at all-cause mortality, the plots, the little scatter dots actually get tighter around that line. So it actually shows that even though some people may die of cardiovascular deaths, there are actually fewer all-cause mortality. This is in men, and this is in women. So high cholesterol, I actually feel like is protective. It's part of our immune system. Our liver makes it. If we don't eat any, our liver makes a ton more. If we eat a ton, our liver makes less. So I think, and there's data that you can change these numbers really within just a few days of changing your way of eating. And so if it's something so fluid, I'm not sure it's really a predictive marker, whereas triglycerides and HDL are much more predictive. And we'll see this from Dave Feldman. He's another cholesterol researcher. He's actually an engineer by trade. And what he pulled out of data, so this was actually out of I can't remember the study, but it was a large database. And in the study, they actually categorized all these different cholesterol groupings. So by triglyceride and LDL, so you can see all the triglyceride and LDLs listed in that first column. And then they classified them whether or not you had low HDL or high HDL. And then the OR is odds ratio. So the odds ratio that you actually had a negative outcome. And what they found is that if you have a high cholesterol, your odds ratio was less than 1, which means you did better than what was expected. Whereas if you have a low HDL, your odds ratio was over 1, meaning you did worse than expected. So 1 being kind of the medium. And if you look at that high HDL column, it goes all the way down. So it doesn't matter what your other numbers are as long as your HDL is high. So that's the most important number in your cholesterol panel. There is also some literature that if your triglycerides are low and your HDL is high, so that ratio is very predictive of cardiovascular death. So that's something that I look at, although this, which is a larger population, maybe the triglycerides aren't quite as important, but still may be important, because if you look at some with the lower triglycerides, that hazards ratio or the odds ratios might be more like 0.6 and 0.7, as opposed to if it's higher, it might be 0.8 or 0.9. And then this, Ted Naiman made this graphic, but this was a study looking at hospitalizations for patients who were hospitalized for coronary artery disease. And what you can see is that the total cholesterol and the LDL, the average of these patients hospitalized with coronary artery disease, were actually not terrible. The total cholesterol average was less than 200, LDL was right around 100, but triglycerides were high and HDL was quite low. And so that is, again, the biggest issue is high triglycerides and low HDL, not total and LDL cholesterol. And I would say, I think he put on there only 21% of those patients were actually on lipid-lowering medications such as a statin. And another study just looking at hospitalized patients in general, so not those hospitalized for coronary artery disease, but including those patients, so any cause of hospitalization. And again, what was interesting is that all patients on average had a higher triglyceride and a lower HDL, whereas they had normal total and relatively normal LDL. This was a recent study that was published through Virta Health. I love Virta Health. They've done amazing work with type 2 diabetics and reversing type 2 diabetics using low-carb ketogenic diets. There was a recent study from a large health network on the East Coast, I believe, that looked at all of the type 2 diabetics and the COVID severity in their population, so in their regional care network. And what they found are in the gray boxes. So 43% of those patients were hospitalized, 5.9% ventilated, and unfortunately 4.8% passed away from their COVID infection. And when Virta Health looked at their patient population, all following a very low carbohydrate ketogenic diet, so controlling for their glucose and insulin, many of them now off medication, so obviously the best of type 2 diabetics, but significantly lower hospitalizations, ventilations, and deaths. And if you actually calculate that out, these type 2 diabetic patients who are following a low-carb ketogenic diet were 16 times less likely to die from COVID-19. So I would say that's a pretty striking difference, and unfortunately, we're not hearing a lot about that in the mainstream press. So another study that was recent that I thought was interesting, especially since many of my patients are on aromatase inhibitors or some prostate patients who are on hormonal therapies that can lead to osteoporosis or osteopenia. This was a study looking at type 2 diabetics and different metabolic phenotypes. So basically, the conclusion, though, was as beta-hydroxybutyrate rises, and if you recall, beta-hydroxybutyrate is the primary ketone body that is generated when you are following a ketogenic diet or when you're fasting, or, so you can create beta-hydroxybutyrate a number of ways, but we definitely get a significant rise when we follow a low carbohydrate diet. That's what you would test in a ketone meter. But when it rises, then the liver, the hepatic, so the liver takes over generating glucose to supply the needs of the body, but also osteocalcin and synthesis and the release increases. So that's bone building chemicals basically are increased when beta-hydroxybutyrate rises. So I've seen a lot of people improve their bone health by following a ketogenic diet. And it's not just a ketogenic diet. We need to make sure we're getting adequate protein and adequate minerals. but typically those come along for the ride when we're following a well-formulated ketogenic diet. A couple of cancer ketogenic diet articles came out. So this one was just out in July. It looked at patients with astrocytomas, low grade, intermediate grade, and grade 4s, which would be our glioblastoma multiformes. 25 patients were put on a ketogenic diet. 21 patients completed it, so 4 patients opted to withdraw. They were on a ketogenic diet for 8 weeks, and they also used 2 intermittent kind of fasting type days. What's classically known as a 5-2 intermittent fasting regimen, but on their eating days, they were still eating modified Atkins, so still ketogenic. They found that hemoglobin A1C, insulin, and BMI decreased significantly in that group, although lean body mass actually increased, so increasing bone and muscle density. And they actually did MR spectroscopy and showed that ketones did increase in the lesions and in the brain. So it'll be interesting to see when they start looking at outcomes, what this might show us. Another one, trial looking at ketogenic diets for rectal cancer patients. Now they're primarily we're looking at body composition, because I think that a lot of physicians and dietitians worry about weight loss during treatment, but I'll tell you that I think it's more about muscle loss during treatment than true weight loss. But in this study, they looked at 24 patients doing a ketogenic diet versus 25 doing a standard diet, although you can see not everybody completed that. So some people decided to go off of the standard diet and do something different, and only 18 of the ketogenic diet patients completed the trial. These were all rectal cancer patients that were undergoing preoperative radiation, and so they were able to actually look at the response or the anticipated response before and after treatment. They did find, as we would expect, that body weight decreased and fat mass decreased significantly in the ketogenic diet, whereas there was no change in the standard diet group. Skeletal muscle tissue was conserved, so there was no lean mass loss. And interestingly, although small patient numbers, but they noted a larger near complete response in tumors in the ketogenic diet group. So 50% of patients had either a complete or near complete response versus only 14% in the standard diet arm. So again, more evidence that maybe the combination of a ketogenic diet with treatment may be optimal. And then I always come back to this because so many people who aren't overweight, and we hear in the news all the time, another healthy person, died from COVID. Well, external fat is easy to see, but what about internal fat? So I always talk about TOFIs, thin on the outside, but fat on the inside. And I'll blow up kind of the area that we want to look at. But these two people had this basic same age, gender, BMI, same percent of body fat. But you can see on the left on the left that there's kind of a white haze surrounding some gray blobs. Well, that white is fat, and that fat is surrounding the kidneys, the spleen, around the liver. It's around the organs in the abdominal cavity, whereas the person on the right might have slightly more, subcutaneous fat because they had the same body fat percent. But you can see how everything in that belly is mostly gray with only small amounts of fat surrounding those organs. So we can't always see the fat on the inside. Now, sometimes we can. That's kind of that abdominal apple-shaped fat that we see some more often on men, kind of that beer belly we call it, but that's kind of that internal abdominal fat stretching out the muscles. But there are thin people that can still have a lot of intra-abdominal fat when we look on a scan. Okay, so to get back to what is a ketogenic diet, what does it mean to be in ketosis? Well, we have to keep glucose low enough so that the fatty acids are actually broken down to produce ketones. And the ketones, that beta-hydroxybutyrate, is what we can use for fuel. We can also use fatty acids. It depends on the organ, the cell types, what they can use for fuel. Some can use glucose, fatty acids, and ketones. Others really can only use glucose, but our liver will make what we need. And there are others that prefer ketones. So cardiac muscle prefers ketones. Brain often prefers ketones. There are 3 different ketone bodies. Beta-hydroxybutyrate is kind of the one that we tend to measure the most. Acetone is what can be expelled through the breath. So there are some people that kind of call it, ketone breath or whatever, that the acetone is being expressed through the breath. We can actually do breath meters to detect acetone, and then acetoacetate is usually expressed or discarded through the urine. So when we do maybe urine testing, we might find acetoacetate. In theory, nutritional ketosis is typically between 0.5 and 3 millimolar. That's of beta-hydroxybutyrate in the blood. With fasting, you can go up a little bit higher, but typically once ketones start getting higher, so if you were doing an extended fast or something and maybe the ketones were really climbing, your body actually will then produce insulin to bring ketones back down, because your body doesn't actually want the ketones to be super high, because then you can actually go into ketoacidosis. So as long as your pancreas is working fine, that's not a problem. And that would be the case for most people, including even type 2s, unless they had no beta cell function. Type 1s, they find that being in nutritional ketosis keeps them using less insulin. They have less highs and less lows, but they do have to be somewhat cognizant if they were to kind of go off plan, because ketoacidosis is when your sugars get high and your ketones are high. But obviously, if your insulin is working, your glucose should be low and your ketones should be kept in check. But do you have to be in ketosis to get benefit? Certainly cutting out sugars and processed carbohydrates, vegetable, nut, and seed oils, and focusing on real food, period, is a great first choice. And when we look at cleaner diets, like the Mediterranean diet, like even low-fat diets originally, we do see some improvements. We can even see improvements in insulin. We probably don't see a huge bump in ketones because ketones you really do need to be in a pretty carbohydrate-restricted state to produce ketones. But you could do maybe a clean Mediterranean diet with some intermittent fasting and get some intermittent ketosis. So everybody's a little bit different as to how strict they need to be, and do they get improvements just following a general low-carb, paleo, primal, or Mediterranean, or vegetarian, or whatever diet, maybe. But I've also seen people significantly increase their weight or increase their insulin following some of the higher carbohydrate, even though they are whole food carbohydrates. But again, once we cut out the worst foods, almost everybody feels somewhat better. And so that's what tells them that that diet is working for them. But it may only work for a certain period of time, and then maybe need to go a little stricter. But each step in the right direction is a good step. What do I find as kind of the biggest mistakes when people switch to keto? I would say trying to replace old sugars and processed foods with keto approved foods. So replacing breads and baked goods with keto breads and keto baked goods, doing the keto or fatty coffees, because I think it's an inadvertent way to get a lot of calories. And calories, even though they don't matter as much as carbohydrates, they do still matter. We know that when somebody goes on a ketogenic diet, their basal metabolic rate typically increases about 300 calories, 350. But a keto coffee could have 500 calories. I mean, who knows? If it's being used as a bridge to help with intermittent fasting, and then we slowly wean off of that, it may be a good temporary bridge to get people to the other side. But ultimately, I would prefer people not use those. That being said, if somebody has a disease that actually needs ketones 24/7, like seizure disorders, maybe Parkinson's or Alzheimer's, then I would say if we're not looking at the weight loss perspective, we just need to keep our ketones high constantly. That's a great option for them. I will see people overeating nuts and cheese. They're easy to do, especially if you buy them from Costco and you have big packs and you just sit down and hand in hand. I would suggest that if you're going to do those, it should remain kind of a small handful, or maybe portion them out when you first buy a bag or a can of something and put them into small serving sizes to help you stay on point if you are eating them. And then the other thing I see is smoothies and protein shakes and protein bars. And what I'm really trying to get us away from is away from eating processed foods. So obviously the protein powders and the protein bars are just another processed food. They typically have additives that we don't want. Smoothies are just a way to break down the fiber. Even if you keep everything in the smoothie, you are basically masticating it before you eat it. And so now you're drinking calories. You're kind of getting a quicker hit of the sugar. So typically the glucose spikes are higher, which would mean then the insulin spikes would be higher. So really you want to eat and chew deliberately food, and you want to drink 0-calorie beverages. I just decided to throw in an example of processed carbohydrates. So this is white bread. This is just one particular brand. You can see that the serving sizes is actually 2 slices of bread, being roughly 53 grams, 150 calories, and 26 carbohydrates. When we look at the ingredients, we can see wheat flour, we can see soybean oil, sugar. So already the 3 things that I think are the worst foods on the planet are the first 3 ingredients, well, minus the water. And if we look at a very popular keto bread, again, this is only for 1 slice, which is 30 grams, so actually a bigger slice than the prior loaf. It says total carbohydrate 12 grams, but it then tells you that it's 0 net carb because it's 12 grams of fiber. But let's read the ingredients. So again, we're starting with a wheat starch, wheat gluten. Yes, they might be fiber, but they are not in their natural state like fiber would be in a piece of broccoli. And then we have soybean oil. We have fully hydrogenated soybean oil, so that's a trans fat. Bottom line is, if the ingredients read like a regular non-acceptable food, then it's a non-acceptable food. So this is not ideal, which is why I usually say if you are going to consume processed foods in any way or foods with a label, please count total carbohydrates and do not subtract fiber because they are not in their natural state. If you are going to have a salad with lots of vegetables and maybe some nuts, you can subtract the fiber. I find it's easier just to tell people not to ever subtract fiber, but I don't want to penalize those who are trying to do a more plant-based ketogenic diet. So in that setting, I do recommend subtracting fiber, but not in a product. And I shared this last week or last month, but I thought it was good. So if anybody wasn't here last month, this was a great 9-minute YouTube video of a UK doctor who switched his diet from about a 20% ultra processed food diet. So we would consider that bread to be ultra processed food. And he switched to 80% ultra processed foods. And you look at labs, body composition, and MRI brain before and after just 30 days. Pretty impressive stuff. Again, my bias is that all food should be single ingredient foods to the best of your ability. So 20 grams of carbohydrate is usually where I start people, less than 20 grams of carbohydrate. And you can see that a half of a bagel or half of a bun is 20 grams of carbohydrate, but that is a ultra processed food, whereas you can get lots of vegetables, a handful of nuts, some low glycemic fruits for less than 20 grams of carbohydrates. So you actually get a whole lot more food, a lot more fiber, and a lot more color if you're following a low carbohydrate way of eating, if you're focusing on real foods. Eating out, I get lots of questions about what do you choose when you're eating out. So it depends on where you're headed, but as much as I don't prefer fast food restaurants, sometimes you just feel like that's the easiest thing to do, maybe when you're, on a long car ride or something like that. But a burger without a bun, many places now will ask if you'd prefer a lettuce wrap, which is great, or use your bun to hold your burger, and you can peel it down as you go. Salads are a great option when you add proteins, but you have to be very careful about dressings because the majority of restaurants will use soybean oil-based dressings. Even if it's oil and vinegar, it's still soybean oil and vinegar. I have found that there's a few companies out there. F-Bomb is one company, and they have little mini packets, and the F-Bomb stands for fat bombs. But they have individual packets of like olive oil and MCT oils that you could, throw in your purse or throw in your back pocket and take it with you if you wanted to. I find that getting a taco salad is a great idea because you can just use the guacamole, sour cream, and salsa as your dressing, so you don't need to go to an oil-based dressing. If you're at a sit-down restaurant and you can get an entree protein such as steak, fish, chicken, especially if it's grilled or roasted, not breaded or deep fried. You've got to watch out for how they say that they've prepared it, because oftentimes it will be with some kind of glaze. Any glaze is code word for sugar. Look out for sweet sauces, barbecue sauce, etc. So often, I'll just ask them to grill it in some butter, maybe add some salt. But many times they have just nice seasoned fish or just steak is always easy because it's rare that they put any kind of sauce on it. Maybe you get an herbed butter or something like that. And then you can just tell them to hold the starches. And almost every time when you say hold the starches, they ask, would you like double vegetables? Depending on what the vegetable is, I might say yes. I might just say no because I don't want to overeat my carbohydrate at dinner either. But there's lots of options. Typically, you just have to think about each thing that sounds good to you and can you create it in such a way that would be easy for the chef and fit what you need for that meal. So, are you not losing weight? And if you're doing everything right and you're not losing weight, what might be the issue? First, maybe you're losing inches. We just showed a number of studies where lean mass either didn't decrease, but maybe even increase. So maybe you're building bone density. Maybe you're building lean mass in your muscles. A number of pictures that I always like to show people at the same weight, but with different body composition. So it's not about your scale weight. It's about how do your clothes fit? How do you feel? How do you look? What are the inches? So again, these are people all at the same weight. But maybe we're not doing everything right. Maybe you're not focusing on eating real whole foods. Maybe some processed foods and diet drinks and sweeteners are kind of sabotaging your progress. Maybe you're doing too much in the way of nuts or cheese. Some people do have a dairy intolerance, and even adding, a splash of heavy cream to their coffee stops weight loss. So I do occasionally ask patients to try to go dairy free for a couple of weeks and see if that doesn't get them back on track. Back to eating keto baked goods, making desserts, keeping that sugar craving alive can be detrimental to many. Maybe you're eating a food that you have a sensitivity to and that you don't know it, so you're actually have some underlying inflammation that's keeping water weight on you, or that's creating some other inflammatory process. So sometimes we might want to consider a more strict elimination diet to test some of those things. Maybe you've had the carb creep, and I spelt that wrong, I'm sorry, typo, but you get comfortable with eating low carb, and then all of a sudden you're eating, again, more nuts, or maybe you're having more vegetables. Maybe you kind of stopped keeping track. And so I usually say, just log back in, take a day or two, track your food, see maybe where there's something that's, kind of fallen off the tracks a little bit. I have seen people not eat enough calories, and so they either don't lose weight or, to be honest, start gaining weight. After 7 days of calorie restriction, your body actually starts to decrease your basal metabolic rate. It starts to hold on to fat because it feels like, or it thinks that there's a famine coming. It makes people feel more tired because the body is saying, sit down, don't burn unnecessary calories because you're not eating enough calories. So I usually want to make sure that we're getting at least enough to cover our basal metabolic rate plus day-to-day activity. You burn calories just by existing. Or maybe you're eating a little bit too lean. So there are some people who, if they eat too lean, protein does cause some blood sugar and insulin increase, although not nearly what it is compared to carbohydrates. But we want to moderate that with fat. We want to burn that fat for fuel. So sometimes eating too lean, also sometimes eating too fat. So it's really a game. You have to play and you have to try different things because every person is a little bit different. Sometimes people aren't eating enough protein. If we don't eat enough protein, we raise leptin. Maybe we're compromising our lean mass. We're starting to break down lean mass, and so our body composition is actually getting worse. Maybe eating too often. So there's some people that even though they're eating low carb, they graze all day. So make sure you're not eating more than 3 meals per day. We can add some intermittent fasting. I'm more of a fan of intermittent fasting and intermittent feasting because we don't want to, if we are intermittent fasting, we don't want to be eating too low of calories day after day after day. So we want to kind of mix that up with heavier eating days and maybe lesser eating days. What about cheats? We've had a few holidays. Have we kind of gone off the rails? Maybe a few days of cheating ends up being a few weeks. Maybe that's setting us back. And I will say that there have been some studies that just cheating a day or two can actually decrease ketosis for another week or two in some people. So it takes quite a long time. So if you're cheating maybe every Friday, maybe you're never getting to the point of burning fat. And maybe you're not actually in ketosis. Maybe, yes, you're eating low carb, but it's not low enough for your personal carbohydrate tolerance. So sometimes checking, either using urine strips or blood glucose blood ketone meter or a breath meter to see, are you producing ketones? Are you in a fat burning state? If not, maybe you need to drop those carbohydrates a little bit more. Maybe we need to tweak things. And then, are you drinking too much alcohol? Certainly that's calories, even though many alcohols might be zero carb or very low carb, it still can affect glucose and insulin. It can also increase calories. So if you're really interested in losing weight and not losing weight, you might want to consider cutting that out. What about non-dietary things? You're not incorporating enough movement. Do something that you like so that you can do it multiple times throughout the week. Doing resistance training or HIIT, high intensity interval training, can actually further improve blood glucose and insulin control. Move frequently throughout the day. So if you have a sedentary job, or maybe you're retired and tend to hang out on the couch a lot, get up. Maybe get one of those things that alert you to, get up and move. Maybe pick some times to walk around the block. Maybe say every single time I eat, I'm going to go for a walk. Maybe if you're on a conference call, that you can stand up while you're on it. Sleep. Sleep has definitely been shown to affect glucose and insulin. When we are sleep deprived, we get increased cortisol. So set a good bedtime routine. Try to turn off screens before going to bed. If you can't, use maybe some blue light blockers. There is some evidence that adding magnesium can help with sleep, sometimes adding melatonin. But blue lights can there's a great book called The Circadian Code that kind of goes through light-dark cycles. It's pretty interesting to kind of learn, like, if you were to go to the drugstore, grocery store after dark, those bright lights actually kind of drop you're building this what's called sleep debt, so that when you get to bed, you're tired and you fall right asleep. And you go to one of those stores, and it apparently can kind of dump your sleep debt and start you over almost, because it thinks it's right in the middle of the day. You're too stressed out. That also increases cortisol. So then we have to think about what are things that we can do to reduce our stress. Are there things that we need to change in our life, or do we just need to maybe add some things like meditation or yoga, breathing, mindfulness, something that can help us respond or decrease, diffuse when we are stressed. And then for some people, it might mean, switching jobs or letting go of quote unquote friends that are actually not helping you in any way, shape, or form. So things to assess and address. And finally, I have this dream of doing a small group challenge. So for those that are following a low carb or ketogenic diet but are struggling with weight loss, or maybe struggling lowering their insulin, doing maybe a 6-week challenge. Might start in September. We would do it hopefully through LivingWell in similar meetings like this, but I would do maybe a quick weekly Teams meeting, maybe just, a 30-minute or 20-minute check-in. I would love to get some baseline information for participants, getting some basic labs, body weight, body measurements. I have a machine in my office that can give us BMR and body fat analysis. And then we would do something like a feasting and fasting, kind of like a 5-2, where we would have 2 days where we would fast, and you would pick the days based on your schedule. We would tailor the fasting a little bit based on your own personal fasting history, how comfortable you are. If you've just been doing, 14 or 16-hour fasting, or have you done some 24 or 36-hour fasts? And then we would feast based on body weight and activity level. And then we would want to make sure that we're meeting protein requirements to optimize that lean mass. So just a thought. I'm trying to work through the details, come up with kind of a proposal. And then if that comes to fruition, we will send everybody that gets this email an invitation, and then I'll limit it to a relatively small group just to get us all started, get me comfortable. If I have the bandwidth to actually do this, then we'll do it maybe more often. But anyway, so that's the end of what I have for today. So I'm going to stop the recording.